Okay, so yeah, welcome everyone to the IPMC seminar series. We're very lucky to have our speaker, Dr. Chris Letheby, for this session. So Chris is a lecturer in philosophy at the University of Western Australia. So his areas of specialization are in philosophy of mind, philosophy of cognitive science, and philosophy of neuroscience. So he's got particular research interests in the causal mechanisms and epistemic status of transformative spiritual practices, on the possibility of a naturalistic spirituality, and then on the nature of self-awareness. So Chris, I'm sure as many of you are aware, has published numerous articles in well-respected journals. He's also published a monograph entitled Philosophy of Psychedelics. And so this was published in 2021 by the leading press, Oxford University Press. And the book has been very, very, very well received. So it's won a number of awards. It's currently being translated into Spanish, which is very cool. And there was also an open access symposium on the book published last year by the journal Philosophy of and the Mind Sciences. And so as coincidence would have it, we have one of the editors of said journal and also one of the contributors to that special issue on the symposium on the book in the audience with us. So it should be a great discussion, hopefully a great talk. We're very lucky to have you, Chris. And yeah, everyone, please join me in welcoming Chris to our seminar series.
Thanks very much, Chris, for that lovely introduction. Thanks for coming, everyone. It's great to be here virtually with you all. Now, the obligatory technical difficulties as I try and share my screen, and I don't think I've actually done this sort of thing through Google Meet before, so I'll have to try and figure out how to do it. Is it this little button that says present now? Is that what I want with the arrow pointing upwards? Yeah. Okay. Present a window. Here's my slides. All right. Can you all see my slides?
Yeah.
Come through, yeah.
Yeah, great, thanks. Okay, so the talk is called Psychedelics and Knowledge How, and I have given this exact talk once or twice before, and I gave it once when I only had a 30-minute window, and I did manage to deliver the entire thing in the 30-minute window. So in theory, there's a possibility that I'll go under time, but I will say if I go under time, that would be a first in the history of the universe. So I'm not too worried about it. I'm just going to work through it all and we'll see how we go. And in the worst case scenario, we'll end up with a lot of time for discussion. And if someone could tell me if I'm starting to run out of time, give me maybe a 5 or 10 minute warning, please. That would be great.
So, sorry, Chris. Oh, sorry. Yeah. No, I was just going to say we see all of your slides, but now we can see the main slide, so it's gone perfect.
Oh, good. Yeah, I just started the slideshow, so all good. And you can still see me too?
Yep.
Good. I can't see any of you, which is weird. I'm used to the Zoom scenario where you can sort of see a few people down the side, but I'm just talking to a camera. So
I think there's a way. So I'm not very good with technology, but I think there's a way of doing it. If you put it on reading mode, then you can see us on the side.
Oh, look, I think it'll be okay. I've been recording lots of lectures over the past few days anyway, so I'm actually getting used to just talking to the camera. So I'll see how I go.
Yeah, perfect. Yeah. Thanks, Chris.
All right, thanks. So, psychedelics and knowledge how. I'm going to start with a story, and I want to begin by acknowledging Frank Jackson for pioneering and my good friend and colleague Miri Al-Bahari for continuing this particular genre of philosophical fable. The story goes like this. You have a friend whose name for various reasons is Maria, and Maria is an expert in the mind and brain sciences. In particular, she's thoroughly conversant with the academic literature on the class of psychoactive substances known as classic psychedelics, or serotonergic, in other words, serotonin-acting hallucinogens. And so here's just a very small sample of some of the many things that Maria knows about classic psychedelics. She knows that the most famous examples of this class of drugs are LSD, mescaline, psilocybin, and DMT. She knows that these drugs can cause a wide range of alterations to conscious experience, including dramatic changes to perception, emotion, cognition, the experiences of space and time, and the sense of self. She knows that their effects on conscious experience are highly variable and are influenced strongly by what's known as set and setting. In other words, the total psychological state of the person taking the drug and the environment, physical, social, aesthetic, etc., in which they take it. She knows that they cause these dramatic and variable effects on consciousness mainly by stimulating the 5-HT2A or serotonin 2A receptor in the brain, that they have different pharmacological mechanisms and also different experiential effects from various other drugs and types of drugs that sometimes get called psychedelics, such as ketamine, cannabis, MDMA or ecstasy, and salvia divinorum. So these are all sometimes referred to as psychedelic in the broad or loose sense of that term, but they don't fall into this class of classic or serotonergic psychedelics. Maria also knows that classic psychedelics, or as I'll call them henceforth, just psychedelics, were studied as experimental psychiatric treatments in the 1950s and 60s, and that a recent wave, or relatively recent, going on 30 plus years now, of rigorous scientific research has shown that contrary to popular wisdom, they can in fact be administered quite safely in carefully controlled conditions to suitably screened and prepared volunteers, where this includes both healthy subjects without a psychiatric diagnosis and psychiatric patients with diagnoses of anxiety, depression, and various forms of addiction. It excludes, however, anyone with a personal or immediate family history of psychotic mental illness. Such people are excluded from these trials, and that's believed to be one of the ways of ensuring the good safety profile. So Maria also knows that in these trials, 1 to 3 controlled psychedelic experiences, moderate to high doses under supervised conditions, often in conjunction with some kind of therapy, consistently leads to psychological benefits, where this can encompass reductions in psychiatric symptoms, positive personality change, increases in self-reported well-being, and this kind of thing, lasting for months or in some cases even years after just 1, 2, or 3 doses of the drug. And she knows the interesting fact that these kinds of lasting psychological benefits after 1 to 3 controlled psychedelic experiences are consistently and strongly predicted by the occurrence of a specific type of experience during the drug action, a transcendent so-called mystical type experience of oneness, unity, or cosmic consciousness. Now, this sort of experience doesn't happen to everyone who takes psychedelics. As I said, the effects are extremely variable, and whether or not this kind of experience does occur seems so far to be the most consistent predictor of whether you get these lasting beneficial psychological outcomes. And finally, Maria also knows, not finally, she knows lots more than this, but she also knows that psychedelics have been shown to disrupt the coherent functioning of various large-scale brain networks, including the famous, much discussed default mode network, which has been linked to various cognitive functions, including sense of self, autobiographical and social reasoning, theory of mind or mind reading, and so forth. But there's a twist coming, and I'm sure some of you can guess what it is. Despite this wealth of academic expertise about psychedelics, Maria herself has never taken a psychedelic. That graphic there is meant to represent your likely reaction upon having this shocking twist revealed to you. So Maria knows, we might say, virtually everything there is to know in a third-person, objective, scientific kind of way about psychedelics, what they do to the brain, what they do to the mind, how they work, but she's never taken a psychedelic herself. Now things get interesting, right? At this point in the story, Maria is accepted as a volunteer in a scientific study of psilocybin. She goes off, she does the preparation, she has the experience, she talks to you about the experience afterwards, and she describes it, as most people who participate in these trials do, as fascinating and rewarding. But not only that, she makes a claim that, again, a lot of people who undergo these experiences make, which is she claims to have learned important things from the experience. In other words, Maria claims to have gained significant epistemic benefits from the psychedelic experience. Now, I presume the audience is mostly philosophers, and so I can presuppose jargon like epistemic. Just in case anyone hasn't encountered epistemic, it means knowledge related, right? You probably all have, but there you go. So the question I want to pursue is this true, right? Has Maria really gained significant epistemic benefits from her psychedelic experience? If so, what kind or kinds, and how might she have gained them? How might these drugs and the experiences they induce have led to the acquisition of various kinds of epistemic benefits? Now, in my book, I argue that psychedelic experiences, when conducted in controlled therapeutic settings, routinely, typically have 5 distinct types of epistemic benefits. This claim has been contested. Various objections have been raised, but my position is that under controlled circumstances, subjects routinely gain forms of knowledge that, factual or propositional knowledge, forms of knowledge how or ability knowledge, forms of knowledge by acquaintance, new knowledge of old facts, and indirect epistemic benefits. In other words, epistemic benefits that result not from the psychedelic experience itself, but from its lasting psychological and behavioral consequences. And so this argument, this all comes from chapter 8 of the book, which is about epistemology. And it's part of the broader project of the book, which is to reconcile psychedelic therapy and philosophical naturalism. So I'm someone who is very sympathetic to naturalism of both the metaphysical and methodological varieties. And to a naturalist, at first glance, psychedelic therapy looks pretty weird and a bit worrying. You know, you've got this strange new psychiatric treatment that's being described as a remarkable breakthrough, which seems to work centrally by inducing these transcendent mystical type experiences, as they're called, of oneness, unity, divinity, or cosmic consciousness. And so if you look at this in a coarse-grained way from a naturalistic perspective, you might get worried, and you might ask the sort of question that Michael Pollan asked in an article in the New Yorker: is psychedelic therapy simply foisting a comforting delusion on the sick and dying? And the concern embodied in that question is what I call the comforting delusion objection to psychedelic therapy. And the overarching thesis of the book is that the comforting delusion objection can be answered from a naturalistic standpoint, right? Even from a naturalistic standpoint, it turns out ultimately that psychedelic therapy does not work mainly by the objectionable induction of comforting but false beliefs. So this is just one strand of the overall project, is arguing that psychedelic experiences in controlled conditions typically have various kinds of significant epistemic benefits, even from a naturalistic standpoint. The other half of it, which I won't get into here, is arguing that its epistemic risks or epistemic harms from a naturalistic standpoint are less great than they might initially appear. But here I'm focusing solely on the epistemic benefits, and indeed just on one benefit in particular, knowledge how. So we come now, after that long throat clearing exercise, to the beginning of the talk proper. It's in 3 parts, but they're each fairly short. I'm going to start by giving some qualitative evidence in the form of first-person reports that hint at the idea that people might be gaining some kind of knowledge how from these controlled, clinical, supervised psychedelic experiences. In the second part, I'm going to turn to quantitative evidence and formulate an explicit argument for that conclusion, which I call the argument from mindfulness-related capacities. And then in the third part, I'm going to consider and, well, I don't know about answer, but think about how one might answer an objection to that argument, which I call the causal pathways objection. So it's a very nice kind of familiar structure for a philosophy talk. We've got an initial idea, then we've got an argument, then at the end we've got an objection to the argument and some kind of gesture in the direction of a response to the objection. So that's how it's going to go. Starting then with the qualitative evidence. Here are some first-person reports that hint, or perhaps do more than hint, at the idea that some kind of knowledge how might be gained through psychedelic experiences. So this is a patient with treatment-resistant depression who received psilocybin in a clinical trial. In other words, this person had had depression that had failed to respond to at least 2 previous other treatments, and then they received psilocybin with psychological support. Being interviewed afterwards, reflecting on their psilocybin-induced experience. That's the active ingredient in so-called magic mushrooms, for anyone who doesn't know, psilocybin, and that's the most studied psychedelic in this recent wave of research. So looking back on their psychedelic experience, this person says, I saw negative patterns in my life. In other words, this is what they saw during the experience, where if something bad happens, I used to just put it to the back of my mind. Afterwards, after the psychedelic experience, I allowed myself to experience everything, even if it is sadness. Now I know how to deal with my feelings rather than repress them. So I've added my own emphasis there because, of course, it seems very significant to me that this person is explicitly using the phrase know how, right? They are explicitly claiming to know how to do something as a direct result of their psychedelic experience, namely how to deal with their feelings rather than repress them. Here's another one. This is a different patient from the same cohort, psilocybin for treatment-resistant depression. This person says, I took away from the experience that I used to get angry about having anxiety. Now I think I can have the anxiety. I can just feel it and it will go. I don't have to have the fear or run away. So you haven't here got the explicit language of knowledge how, but it still seems clearly to me to be talking about something very similar, you know, having learned skillful, helpful, healthy or beneficial ways of dealing with or relating to emotions through the psychedelic experience. Finally, I think this is the final one. Yeah, finally, we have a healthy volunteer without a psychiatric diagnosis who received multiple psilocybin sessions with different doses of the drug in a study. She says, in my third psilocybin session, there was a familiarity to this inner space, and I found I was able to navigate much more easily than during the previous sessions. I felt no fear and was able to keep an even keel emotionally and psychologically and to largely maintain the role of observer. It was like learning to ride a bicycle and leaning into the turns. Again, I find the phrasing here very significant, right? When we teach undergraduates about knowledge how, knowing how to ride a bicycle is one of the paradigm examples that we use. It's a textbook case of knowledge how. So if this person is right and something is going on that is really relevantly similar to learning to ride a bicycle, then it seems pretty likely that what's going on is the acquisition of some kind of knowledge how. So we can see then that at least some psychedelic subjects think they're gaining some kind of knowledge how from their experiences. The question I want to ask is, are they correct? And if so, what kind exactly? And there's a body of fairly recent quantitative findings that speaks to both of these questions. And so that brings us to the second part of the talk. All right. So several recent studies have shown that psychedelic intake can promote what are called mindfulness-related capacities. So what are mindfulness-related capacities? Well, this requires a little bit of background on mindfulness, and I should say I'm not really an expert in this area at all. I have a passing knowledge of the scholarly literature. I'm certainly not a scholar of Buddhism or anything like that, but in very general terms, mindfulness meditation, which is roughly synonymous with vipassana or insight meditation, is a practice drawn from the Buddhist tradition. It typically begins with developing concentration, meditative concentration, so the ability to focus the mind on a single stimulus, a single object, whether that be the breath or sensations in the body. And then once a certain measure of mental stability or concentration has been developed, the practice tends to turn to what's called open monitoring or open awareness, which is a receptive form of attention, a receptive attentional posture or stance, we might say, in which the attention is not directed narrowly to any specific stimulus, but the practitioner simply attends to whatever the passing contents of consciousness are, right? Whatever comes up or whatever arises, as they say, whether it be sensations, perceptions, emotions, thoughts, etc., in a manner that is open, curious, and non-reactive. So the idea is to be aware, acutely and clearly aware of what is arising in consciousness in the present moment as it's arising, but not to get unduly invested or caught up in any of it. You sort of watch it all, let it come, let it go, let it arise, let it pass away. And so, of course, until a practitioner is extremely proficient, this will still occur, this sort of getting caught up or hooked into an emotion or a train of thought. But the idea is once it's been noticed that that's happened, they revert to this kind of open, curious, receptive, non-directive and non-selective attentional stance. experience. Now, mindfulness meditation in particular has been studied a lot scientifically in the last 30 years. Various psychometric measures have been developed and validated to quantify the sorts of capacities that you develop in this kind of practice. So capacities like decentering, which is the ability to, in essence, disidentify with thoughts and feelings and other mental contents, to see them as just thoughts or just feelings rather than as part of me or a direct reflection of reality. Non-judging, the ability to observe the contents of consciousness non-judgmentally without kind of engaging in some kind of discourse about whether it's good or bad to be having these kinds of states of consciousness, and so on. And lo and behold, the consistent finding, you can see all the citations I've got there, which means it must be true. But the consistent finding now across a lot of studies is that a single psychedelic session can elevate these measures of mindfulness-related capacities for up to 3 months, right? Say up to 3 months. Some of these studies are only looking at follow-ups a week later. They're looking at different mindfulness-related capacities. But in general, what's happening is people are undergoing 1 or 2 or sometimes several psychedelic experiences with no explicit mention of mindfulness, with no training in mindfulness or meditation or whatever. They're taking these questionnaires that quantify mindfulness-related capacities before and after their psychedelic experience or psychedelic experiences, and we're seeing significant increases. I mean, in one case, there was a head-to-head comparison of 4, I think it was 4 fortnightly psychedelic sessions with a standardized 8-week mindfulness-based stress reduction course, and it was comparable. The increases in mindfulness-related capacities were around the same for people who had 4 fortnightly psychedelic experiences and people who did an 8-week course of training in mindfulness meditation. There's also studies showing that psychedelic experiences can increase the construct of psychological flexibility, which is a core construct in third wave behavioral therapies. So, contextual behavioral therapies, acceptance and commitment therapy, DBT, and this sort of thing. And psychological flexibility in this sense is closely related to decentering. It's essentially the inverse of experiential avoidance, right? So the more experientially avoidant someone is, the more kinds of experiences they find themselves unwilling to undergo and kind of motivated to avoid, the less psychologically flexible they're deemed to be. And conversely, the less experientially avoidant, the more psychologically flexible. And it is related to decentering. It seems to be related to this capacity to see mental events as just mental events rather than as essential or fixed reflections of the self or of reality. And there's good evidence that this construct of psychological flexibility is a transdiagnostic predictor of psychiatric symptoms. So we've got all this evidence mounting up that 1 or 2 or 3, or in some cases maybe 4 psychedelic experiences can durably increase on their own the same sorts of attentional capacities that are cultivated in mindfulness practice. And this is very easy to relate, I think, to the kinds of things that the patients are saying in the first person report. So they're talking about knowing how to deal with their feelings, feeling the anxiety and letting it go. And this all to me sounds very evocative and reminiscent of the kinds of things that people describe learning in mindfulness meditation training. So this all suggests a hypothesis about the kind of knowledge how that people are gaining. And here's the hypothesis as the conclusion and my nice syllogistic argument for it. So the first premise says that the sorts of attentional skills cultivated in mindfulness meditation amount to a kind of knowledge how. The second premise says psychedelic intake reliably facilitates the acquisition or the increase of the sorts of attentional skills cultivated in mindfulness meditation. The conclusion is that psychedelic intake reliably facilitates the acquisition or the increase of a kind of knowledge how. So I guess strictly speaking, my hypothesis about the kind of knowledge how is not the conclusion. It's it's premises 1 and 2 together, isn't it? And then the conclusion is the pure epistemological claim. So here's one type of epistemic benefit that your friend Maria may well have gained from her psychedelic experience. And I've got a citation there to Benny Shannon, who has an early paper on epistemic benefits of psychedelic experience, of ayahuasca experiences in particular, and he does talk about this kind of thing. I don't think he explicitly uses the language of knowledge how, but he has some very suggestive ideas in that paper, which partly inspired the arguments I'm developing here. So that's the argument from mindfulness-related capacities. It looks valid, and premise one seems pretty plausible to me, right? It seems like I'd be interested to hear if it seems implausible or if anyone has any concerns about it, but it seems to me like a fairly basic conceptual point that when people are practicing mindfulness meditation, when people are learning mindfulness meditation, they're learning how to do something, right? When they're learning how to pay attention to the passing contents of consciousness in a manner that is open, curious, receptive, accepting, decentered, non-judgmental, etc., seems as obvious as anything could be that they are learning how to do something. Of course, anytime a philosopher says that, your alarm bells should ring, but I don't personally see how you could plausibly deny that. Premise two, also on the face of it, seems pretty secure, right? The idea that psychedelic intake reliably facilitates the acquisition or the increase of the sorts of attentional skills cultivated in mindfulness meditation looks on the face of it. I mean, we might want to look at the studies, right? We might ask whether the studies I cited have really established this conclusion securely, but you might think that to the extent that they have, to the extent that the studies I cited are sort of methodologically sound and have sufficiently large samples and all this kind of thing, then this is a premise we can just read off the science. But I'm going to complicate that idea in the third and final part of the talk when we look at the causal pathways objection. All right, so here's a potential worry. Premise two of the argument says the scientific findings I've described show that psychedelics promote the sorts of attentional skills that are cultivated in mindfulness meditation. But you might think the scientific data is equivocal on that point, right? It doesn't actually show that. All it shows is that psychedelics promote the typical effects of those skills. Because you get these people to fill out these questionnaires about, you know, how well are you able to, you know, decenter and, you know, view events in your mind as not personal and as distinct from you, and view events in your mind without judging them and things like that. And it turns out that from pre-psychedelic to post-psychedelic, their tendencies or their capacities to do these things increase, right? But that doesn't necessarily mean they're learning any skills. All it shows is that psychedelics promote or increase the typical effects of mindfulness skills. People are having their tendencies or their capacities for decentering, awareness, non-judging, and so on increased. And this might be happening by a process of conscious learning, right? It might happen because they're learning skills or sort of behaviors, mental actions or cognitive skills that they can exercise that make them better able to do these things. Or on the other hand, it might all be going via an unconscious, low-level, purely neurobiological pathway. So we can call this the causal pathways objection. It basically says there are two possible causal pathways, at least, whereby psychedelic intake might be increasing people's scores on these questionnaires. To conclude that premise two is true and psychedelics are promoting attentional skills, we'd need to know it's one of those causal pathways rather than the other, but the scientific evidence itself doesn't give us sufficient reason to accept that. So to see the force of the objection, I think it helps to consider an intuitive contrast. And I stress intuitive because I'm not committing myself to the idea that all of this is true, right? But an intuitive contrast between antidepressant medication on the one hand, so the prototypical SSRIs, selective serotonin reuptake inhibitors like Prozac, and on the other hand, psychotherapy. So your classic psychotherapy for depression, or gold standard these days, is CBT, cognitive behavioral therapy. Now, it's well established that both SSRIs and CBT on their own can reduce negative emotional processing biases. So in depression, you have these biases towards the processing of negative emotional information over positive, and either a course of SSRIs or a course of CBT can remediate those biases, can tip the balance back in favor of positive emotional information. But plausibly, again, I'm not saying this necessarily is true, but prima facie, it seems as though CBT achieves this outcome by teaching psychological skills, right? Skills of reappraisal and identifying automatic negative thoughts and this kind of thing, whereas SSRIs do it via a non-experiential, low-level, purely neurobiological pathway. Right? So if you ask someone who's undergone cognitive behavioral therapy and their emotional processing biases have been remediated, you know, how did you do that? How did you start being able to pay more attention again to positive information? They can tell you about all these skills they learned. They'll say, oh, I learned how to identify my automatic negative thoughts and to question them and to notice where my attention is going and redirect it. But on the other hand, if you ask someone who is successfully treated for depression with just SSRIs and has had the same sort of change to their behavioral, attentional, and cognitive profile, how they managed to do it, right? How did you manage to start directing your attention towards positive stimuli and away from negative? And they're likely to say, well, I don't know. I'm not doing it, right? I never learned how to do this. I just took the drugs and it happened to me. And so it seems very intuitive in a case like that there's no knowledge how being gained. And, you know, if they stop taking the drugs, again, this is an empirical question, but you might think that if they stop taking the drugs, it's just going to go back to the way it was before. Or even if it doesn't, that's not going to be because they're in an ongoing way exercising any skills. It's just going to be because their attentional and cognitive dispositions have been rewired from the bottom up, if you like, in this purely unconscious way. So the worry is that as far as the scientific evidence is concerned, we have no reason to think that what's going on in the psychedelics and mindfulness capacities case is more like the CBT case than it is like the SSRI case. So one way you might cash this out, right? I don't think this is necessarily the only way to cash out the objection. You could say something like, for knowledge how, you need some kind of conscious learning. There might not be any conscious learning in the psychedelic mindfulness case. Therefore, there might not be any knowledge how in the psychedelic mindfulness case. Now, that can be questioned, right? Not all views of knowledge how entail that conscious learning is required. On some accounts, mere ability might suffice. You might also think that there's something missing there, but conscious learning isn't necessarily what it is. So it's an interesting question that I haven't worked out to my satisfaction, and I'd be interested in anybody's thoughts on it, right? What's the best way to formulate the objection? What is the thing that is required for knowledge how that seems intuitively to be present in the CBT case but not present in the SSRI case, and that we're worried might not be present in the psychedelics and mindfulness case? In any case, I think the way to reply to this worry, and again, whether this actually speaks to the worry depends on how the latter is formulated, but the sort of response I tend to favor is to argue that the relevant causal pathway in the psychedelic mindfulness case actually is experiential, right? So my response to the causal pathways objection involves conceding that, look, the studies I cited, these studies merely showing increased mindfulness capacities after psychedelic intake, on their own don't discriminate between the two possibilities, but we've got other evidence and other arguments that do help tip the balance, and that general considerations about psychedelic therapy and about the transformative effects of psychedelic experience should lead us to favor the hypothesis that conscious learning is involved, and maybe therefore that knowledge how is involved. So there's at least two reasons to think this, right? And the first is the sort of first-person reports that we started with. So those reports I looked at from the psilocybin volunteers sounded much more analogous to the CBT reports that I made up than they did to the SSRI reports that I made up. People are explicitly describing learning how to do things through the psychedelic experience and then deliberately putting that new knowledge into practice after the experience has subsided, resulting in lasting beneficial changes in their psychological and emotional lives. And the second reason is these general reasons, independent of this particular kind of phenomenon, to think that psychedelic administration causes its lasting psychological psychological benefits mainly via the experience, right? So it's not psychedelic administration itself, and it's not the direct pharmacological action of psychedelics that causes this lasting symptom reduction and personality change and so on. Rather, psychedelics induce psychedelic experiences, and it's psychedelic experiences that cause the lasting psychological benefits. And the main reason to think this is that extremely robust finding that I referred to at the start, which is that lasting positive outcomes from psychedelic administration are predicted most strongly and most consistently, not by the dose of the drug and not by any kind of low-level neurobiological variable, but rather by experiential variables, right? So if you want to know whether someone is going to have lasting benefits from a psychedelic experience, the best predictor you can get your hands on is not information about, their plasma concentration of the drug or the dose they received or anything like that. It's questionnaires that they fill out after the experience that quantify the kind of experience they had. And the most consistent predictor has been this construct of a mystical type experience, but there are various other aspects of the experience that also have been found to correlate quite strongly with positive outcomes. Things like ego dissolution, the disintegration of the sense of self, feelings of psychological insight, feelings of so-called emotional breakthrough or catharsis. And as I said, all these correlations between experiential variables and variables quantifying the lasting benefits suggest strongly that it's not psychedelics that cause psychological benefits, rather they cause transformative experiences, and those experiences cause psychological benefits. And some researchers have actually likened psychedelic therapy to a kind of inverse PTSD, right? So the reasoning is there's nothing at all strange or unfamiliar about the idea that a single, discrete, emotionally intense conscious episode can restructure cognitive and affective functioning durably. But the idea is that in this kind of case, and perhaps in the case of naturally occurring non-drug induced mystical experiences, it's essentially the same phenomenon, but the valence is positive and the outcomes are beneficial, rather than the valence being overwhelmingly negative and the outcomes being detrimental. So even if you accept that, right, even if you accept this general model of psychedelic therapy as operating primarily by experiential causation, there are lots of other interesting questions that remain about how exactly it works. And I've got a story about this that I develop in the book, which is that it's mainly about changes to the sense of self, changes to self-consciousness or self-awareness. And this seems to me to be the common denominator between all the different psychological factors that predict lasting benefits of psychedelics. When we look at mystical type experience, ego dissolution, psychological insight, emotional breakthrough, all these kinds of things, the common thread seems to be that they all centrally involve changes to the sense of self. And so this is what I think is going on with the therapeutic and transformative potential. And this is what I think is going on with the knowledge how as well, that by disrupting the neural and cognitive substrates of self-representation, psychedelics induce altered forms of self-awareness, and this is how people find themselves viewing their thoughts and feelings in these open, curious, non-reactive, decentered sorts of ways that are characteristic of mindfulness meditation. And it makes quite a lot of sense when you consider that one of the central purposes of mindfulness meditation in its traditional Buddhist context is precisely to lead to altered forms of self-awareness and to lead to direct experiential insights into the non-existence or something like that of the self. So there's a whole host of interesting questions there as well, but I'm going to leave it there for now. So the conclusion is that there is at least one significant epistemic benefit that Maria might claim quite plausibly to have gained during her psychedelic experience, and this is knowledge how to attend in open, curious, non-reactive, decentered ways of the kind that are cultivated deliberately in mindfulness practice and that involve something like increased psychological flexibility and decreased experiential avoidance. This conclusion is supported by the psychometric evidence about mindfulness capacities, and then as well by qualitative evidence and first-person reports. And the whole idea that this really is an acquisition of knowledge how and a process of conscious learning is bolstered by these general independent reasons that I've outlined for thinking that psychedelic therapy and psychedelic-induced transformation involves experiential causation rather than being a mainly or purely low-level, bottom-up, unconscious neurobiological process. So that's it. I'm assuming I haven't gone over time, and hopefully I haven't gone too much under time. Thanks, everyone.